System helps us to transform the food into substances that our body can absorb. And most of people think that this occurs in the stomach, but this is wrong because all the digestion process starts in the mouth. The mouth starts the digestion process with two types: the mechanical and chemical digestion. The mechanical digestion is made by the teeth and the chemical by enzymes. When these two are combined by chewing and salivation, a substance made bolus is going to be swallowed through the pharynx. In the pharynx, there's an important part that helps us to don't drown us while we are swallowing. This is called epiglottis. The epiglottis helps to separate the respiratory and the digestive system, because when we swallow, it closes the gate of the respiratory system. Then, after it passes the pharynx, it goes through the esophagus. The esophagus is a muscular organ of approximately 3 centimeters, and the bolus is going to pass through here by peristaltic movement, that is like to press and then leave it, and press again and leave it. So the bolus is going to pass slowly to the stomach. In the stomach, the bolus is going to change to chyme. The chyme is made of bolus and the gastric juices that are mixed, and also here the stomach absorbs alcohol and small minerals. An interesting fact is that the people that drink a lot of alcohol suffer gastritis because of that, because the stomach absorbs a lot of alcohol. And it will create two important substances for the protein digestion that starts here: the hydrochloric acid and the pepsins. This will help us to make or break down the proteins, and then it will pass through the small intestine. The small intestine is divided in 3 parts: the duodenum, that is connected to the stomach and is the first 3 centimeters of the intestine, the jejunum, and the ileum. In the duodenum, the bolus is going to start mixing with pancreatic juices, bile juices, and small intestine enzymes. And then in the jejunum and ileum, it will start the absorption of nutrients until it reaches the large intestine. The large intestine is approximately 160 to 120 centimeters and is divided in 3: the ascending colon, the transverse colon, and the descending colon. Now I will make a big parenthesis because we are going to talk about a very common disease in the large intestine, that is colitis. Colitis is an inflammation of lining tissues of the large intestine or colon. People that suffer colitis may have typical symptoms that include abdominal pain, cramping, bloating, and diarrhea. Colitis can be caused by infections, allergy reactions, and that can also produce colitis. And colitis can cause chronic diseases such as inflammatory bowel disease and Crohn's disease. A diagnostic can be made by a doctor and may ask about the frequency of your symptoms and when they first start. The doctor will perform physical exams and will use diagnostic tests to know how you are suffering the colitis or what type of colitis are you suffering. To treat it, you can use anti-inflammatory medications, antibiotic if you have infection, or pain medication if you had a lot of pain, because I had colitis a long time ago and it's very painful, so I recommend to take some pills and you will feel a lot better. So ending with that parenthesis, the large intestine absorbs all the water of the chyme, and we can say that when we have diarrhea, the large intestine is not working well, so it's not absorbing water in a proper way, so you're expelling all that water, and that's a common disease, so I know what to do. But if you drink water, a lot of water, you will feel better. And last, we have the rectum, that is right, like there in the diagonal. The rectum will stretch our poop and it will expel them when we want to go to the restroom. And the cycle is going to be over and over again every time you eat and every time you, every time you eat.